said, I'm Rebecca Salvo. I'm a PGY3 here. I'm doing a presentation on Roid rage in reference to steroids. And the topic is, do corticosteroids improve mortality in alcoholic hepatitis? Alcoholic hepatitis is not an uncommon thing that we see on our service. And the problem is we don't really have great treatments for it. And the question is, are the known treatments that we have actually effective? So what is alcoholic hepatitis? It's a syndrome of acute liver injury in people with known alcoholic liver disease or heavy alcohol use greater than 6 months. So in the United States, just for your reference, heavy alcohol use is defined as greater than 100 grams of alcohol per day. And one beverage, say like 5 ounces of wine or 12 ounces of beer, contains about 14 grams of ethanol. So that's about 7 drinks a day. The other definition is greater than 8 drinks per week for women, or greater than 15 drinks per men per week. But the diagnostic criteria for alcoholic hepatitis includes bilirubin greater than 3, AST greater than 50 but less than 400, and an AST-ALT ratio greater than 1.5. And then there are 3 different also diagnostic criteria, including those lab criteria. Definitive alcoholic hepatitis is liver biopsy proven. Probable is known alcohol use disorder and other liver diseases ruled out. And then possible alcoholic hepatitis, which you have a suspicion of alcohol use, probably based on their alcohol history, but there is a presence of other alcohol disease, such as drug-induced ischemic or a virus. So what is the pathophysiology behind alcoholic hepatitis? And it's a pretty complicated study, but just briefly, it's thought to be due to the direct toxic effects of alcohol, namely acetate and acetaldehyde, and changes in the gut biome on the innate and adaptive immune system. Inflammatory signaling sets in with following responses driven by cytokines. And then all of these pathways activate in the hepatic tissue. They crosstalk with the hepatic stellate cells, lay down abnormal collagen, and leading to abnormal hepatic hemodynamics and abnormal liver textures and inflammation. So the rationale behind the use of corticosteroids is that they have immunomodulatory and anti-inflammatory effects. So the steroids are thought to travel into the cell due to their lipophilic nature and ultimately penetrate the nucleus, resulting in positive upregulation of anti-inflammatory gene expression. The direct stimulatory properties of corticosteroids work in conjunction with its properties to indirectly inhibit pro-inflammatory gene expression, notably NF-kappa B and activator protein 1, and the net result is a reduction of inflammatory cytokines, most importantly TNF-alpha. So what do our current guidelines say about treating alcoholic hepatitis? So according to the American Journal of Gastroenterology, most recently updated in February 2018, says that patients with severe alcoholic hepatitis should be treated with corticosteroids if there are no contraindications for the use, and that's a strong recommendation. And then according to the AASLD, which is the American Association for the Study of Liver Disease, they state that prednisolone 40 milligrams per day given orally should be considered to improve 28-day mortality in patients with severe alcoholic hepatitis, defined as a discriminant function greater than 32, without contraindications to the use of steroids. But where do these guidelines come from? So I went back, and this was the first article that I could find published in the New England Journal in 1971, which was basically a review of 2 previous controlled trials, or the only 2 controlled trials that have been done up until this point. And what this showed was that one of the studies showed benefit to steroids and the other one didn't. And the discrepancy was thought to be that the one that did not show benefit of the steroids had more severely ill patients. However, if you were to read on, the author still states, "It is my interpretation that a beneficial effect of prednisolone therapy has been shown in the patients who, although severely ill, have a chance of recovery." And then moving forward, another randomized controlled trial in 1992, also in the New England Journal, was a randomized double-blinded controlled trial with about 65 patients, all with discriminant function greater than 32, 2 arms present. There were those with the steroid group, which was prednisolone 40 milligrams versus a placebo, and they were treated for 28 days. And this analysis showed that survival was significantly better in the corticosteroid group. Shown here was about 13% versus 55% mortality in the placebo group. There's a follow-up letter to the editor from a physician, a gastroenterologist, who wrote to the New England Journal with two flaws of that study. And basically what he was saying is that the patients that were randomized to the placebo group were much sicker based on prognostic values, and what they were looking at was the creatinine, the albumin, and the bilirubin, which were all significantly worse in the placebo group at randomization. And he also noted that in the study, the majority of the patients, 65% were women, which did not correlate to the population, or was not representative of the population throughout the United States, which is usually mostly men. So he thought that there was bias, and he didn't think that it was a good study. Moving forward, this is a short meta-analysis of 5 randomized controlled trials looking comparing survival in patients with severe alcoholic hepatitis, again defined as discriminant function greater than 32, in which about 200 patients were allocated to receive steroids and 200 to receive placebo. And what they found was that the 28-day survival was higher in the corticosteroid-treated cohort, about 80% versus 65% in the non-placebo group. And this was in the sub-analysis group was shown that it was just strongly associated among the Lille model, which is used to identify early patients with severe alcoholic hepatitis that are likely to respond to steroids, and you reevaluate at 7 days. But the benefit was only in patients who had a positive Lille model, and that benefit was only seen at 28 days and not past that, which is shown here. But I think the most trial that everyone or most people are familiar with and what most of the guidelines are based on is the STOPPA trial, which is the steroids or pentoxifylline for alcoholic hepatitis. And this was a multi-center double-blind randomized controlled trial in the UK with over 1,000 or 1,100 patients randomized. And interestingly, their initial analysis showed that there actually was no mortality benefit observed among patients treated with steroids versus not steroids. However, when there was secondary analysis done, adjusted for baseline determinants of prognosis, they showed that only prednisolone alone improved 28-day survival, and I'll show that here. So initially, this was the initial data here, prednisolone versus placebo was not significant with a p-value of 0.06. However, when they broke it down into secondary analysis, they showed that the odds ratio was 0.61 with a p-value of 0.02, which showed some significance, but only at 28 days. There was no benefit at 90 days or 1 year, which is shown here. And then this is, again, just a more a visualization of showing that essentially all of the lines are similar, placebo versus not placebo, all the way out to 1 year. And also, in this study, pentoxifylline, in case anyone was wondering, was not shown to be beneficial at all. Okay, so I don't know if I maybe convinced you that steroids are beneficial, but I'm going to try to show you why they probably aren't. So going back in history again, a study in 1977 about using, again, corticosteroids versus placebo in alcoholic hepatitis was another small study, 28 patients, 12 randomized to the steroid group and 16 in placebo, looking at mortality. And what they saw here, and I'll show you here, was that actually the placebo group had lower mortality, but not statistically significant. And they looked throughout 60 days here. The next study here, 1995, was a meta-analysis of randomized controls trials trying to adjust for prognostic variables. And what they found over these 12 studies was there was application of publication bias favoring glucocorticoid treatments in the prior studies. And then even after adjustment for imbalance by weighted logistic regression analysis, the overall effect on mortality was not statistically significant. And their conclusion was that these results do not support the routine use of glucocorticoids in patients with alcoholic hepatitis, including those with encephalopathy. Most recently, in 2019, there was a Cochrane review about the use of steroids for people with alcoholic hepatitis. And this was a meta-analysis of 15 randomized controlled trials comparing steroids to placebo with over 900 patients allocated to each group. And what they found was that there was no evidence of effect of glucocorticoids on all-cause mortality up to 3 months, and no evidence of effect of liver-related mortality up to 3 months following randomization. And their conclusion, written here, was we could not determine whether glucocorticosteroids had a positive or negative effect on people with alcoholic liver disease. Despite available data on outcomes, which included mortality, health-related quality of life, and serious complications, we were unable to draw firm conclusions, mainly because available data were still insufficient to produce robust results. Trials were small, and the included participants differed in severity of disease. I want to end with this study, which I found very interesting, which looked at survival from alcoholic hepatitis over a period of 45 years. So they reviewed 77 studies starting from 1971 to 2016 that included over 8,000 patients. And what they saw was that overall mortality from alcoholic hepatitis was 26% at 28 days, 29% at 90 days, and 44% at 180 days after admission. But no changes in mortality over time were observed in univariable analysis at 28 days or 90 days after admission. A small but statistically significant increase in mortality was seen at 180 days. And I will note that not all of these studies looked just at steroid versus non-steroid. So 44 of these looked at interventions, and 33 of them were just observational studies. But they did break it down when considering therapeutic trials only. No statistically significant change in mortality over time was observed at each time point. So 28 days, 90 days, or at 1 year. And they did the same when looking at intervention and control groups considered separately, and there was no improvement seen. And then lastly, they also tried to separate by biopsy-proven alcoholic hepatitis and separating those with the discriminant function greater than 32, so to see if the sickest patients and biopsy-proven, if there was any proven mortality benefit with steroids. And they also saw no change in mortality over time. And this is shown just throughout. This is the graphical representation of all their data. So if you're looking from 1971 to 2016, here, I mean, the 6-month mortality actually looks like it's uptrending, 28 days about the same, and same with 90-day mortality. And that's with about half of the studies using steroids. So I will leave that with you to decide if you think that there is good evidence for the use of steroids or not. And is it a myth? Corticosteroids reduce long-term mortality in alcoholic hepatitis.
All right, thanks. That was great. Anybody have any questions, comments? Yes, Dr. Buxbaum.
I assume that most of these studies were done with prednisolone, is that right?
Yeah, prednisolone 40 milligrams.
And the recommendation is put forth is that it be prednisolone that's prescribed.
Correct.
And just the theory behind that is that prednisolone requires hepatic processing to be converted to prednisolone in the liver, and if your liver is sick, it may not work. I had the opportunity to find out at the county pharmacy what was happening because I had several people who got sent out of the hospital came in on prednisone instead of prednisolone. And I found out that the county pharmacy does not give out prednisolone, even though that's what's on the prescription. They changed they substitute prednisone for prednisolone. Now, I don't know if that makes any difference in the effect of this, but when you think you're putting someone on prednisolone at the county pharmacy anyway, you're not.
And it looks like it doesn't.
And who made that
Was it
policy?
expired prednisone?
Any other comments or questions? Nobody? Really? Yeah.
For me, I have seen prednisone change the quality of life of people with alcoholic hepatitis just because it takes away the fever, the poor appetite, and I've seen people in the hospital, again, anecdotal, who are in the hospital going nowhere, and we get a second opinion from ID who starts steroids, and they're out of the hospital in 48 hours. Now, I don't think that affects their mortality, but quality of life, I think it makes a huge difference. And cherry picking those ones where it can have that effect is a different question than what you're asking, but that's why I use the drug.
So from what I understand, you treat with prednisolone for 28 days. So it's kind of interesting to me where you treat for 28 days and all the outcomes, we're looking at 28-day outcomes where there might have been like a difference, but then after that, once you stop taking the steroids, you end up being in the same position. So it's just kind of very interesting how the study designs and the treatment has really come to be.
From the gastroenterologists you've worked with, are they still doing this, or are most of them aware of these studies?
Most of them actually still are using it, mostly because they don't have anything else. And it's usually more of a last-ditch effort.
Anybody else? I think I agree that it might make them feel better, but it probably doesn't change their long-term course. It's like acetaminophen doesn't really, for fever, it treats the fever, but it doesn't really change anything. It may make them worse. We've done that myth too. But the myth that we're going to explore is not whether it makes them feel better, it's just whether it actually reduces mortality. So we're going to vote. Corticosteroids reduce long-term mortality in alcoholic hepatitis. How many people think this is true? How many think it's plausible? How many think that it's a myth? It's busted. Wow, it's busted. It's busted.
2 for 2.
All right, 2 for 2.